Just set that down, Nick.
Ah! Now I can't see anything.
That's okay.
Never.
Ow, it hurts. Are you all right? It hurts. Did you fall? Where does it hurt? My hip. Your hip? Did you trip? Did you trip on something? I tripped on the carpet. Does your head hurt? No, just my hip. Okay, lay still. We're gonna get you some help.
Hi, Miss Bilodeau. How are you today? Hurt. You hurt? Where's your pain?
My right hip.
All right, let's take a look. Oh,
Ow.
wow. Let's talk about where did you get hurt?
I fell.
You had a fall. Okay. And what's your pain?
10
10 out of what?
out of 10.
Out of 10. Okay. And there's a little bit of bruising there. And let me see. Let me see if there's. Do you feel that there's fluid collecting around here?
Yes.
Okay, so we have fluid. And let's see. Are you able to move?
No.
At all?
Not at all. Hurts too much.
And let's see. So just the pain is around this area, right?
Yes, my whole hip hurts.
Okay. So let me bring the doctor over and he's going to assess you. Okay.
Alright, so a fracture usually occurs from a traumatic injury to the bone, which it seems like this is what happened with you. It looks like you have a closed fracture. Here, I see you have a pain level 10 out of 10, so we'll give you something for that. You have any allergies to any medications?
I'm allergic to morphine.
No, she's not going to be on morphine. We'll give her Demerol. Alright, let's see here. Okay, so I see you have a closed fracture, which is different from an open fracture, which is good because open fracture you'd be more susceptible to infections. So, we got lucky with that. Is there a grating sound or like a rubbing sound at all when you move your leg?
Yes, it hurts so bad to move it, and it kind of sounds like it's rubbing together.
Yeah, well, I don't want you to move. Let's stay there, but the grating sound is known as crepitus, and you just want to keep your leg straight, move it around. I'll have the nurses come in and move you every 2 hours. All right, I'm gonna have the nurse come back in, Jess.
Hi.
All right, Jess. I'm gonna need you to look for signs and symptoms. Just keep an eye out for signs and symptoms of shock, just in case. She looks like she's doing fine, but just in case.
All right.
And I'm gonna have the lab tech come in and talk to you.
Okay.
All right, thank you.
Okay, Ms. Bilodeau, are you comfortable?
Now I am.
Okay, we'll be right back.
Hello,
Hello.
Miss Bilodeau.
Yes.
I will be your doctor. And can you tell me what happened?
I was walking.
Miss Bilodeau, can you tell me what happened?
I tripped on the sidewalk and fell on my side.
Okay. How many days ago?
Yesterday.
I'm gonna take a look.
Ow.
Looks like you got a fracture. Do you have any pain?
A lot of pain.
Looks like you have a closed fracture. Fracture occurs with a traumatic injury to the bone in which the continuity of the tissue or the bone is broken.
Okay.
Closed fracture basically is not protruding out the skin.
That's good.
So yeah, that's good. Fractures like yours come from direct force, which causes a fracture at the site of trauma,
Okay.
which would be your right hip. Which would be your right hip. This is not as serious as an open fracture. Open fracture would have more, be more susceptible to infections. So that's good. Do you have any grating sound when you got up and started?
When I got up and tried to move, yes.
Okay. That's known as crepitus. You don't want to keep moving it and they keep you immobile for a little while.
Okay.
Hi, Mrs. Bilodeau. My name is Dawn. I'll be your nurse today. Dr. Contreras just called up and let us know that we're going to be doing surgery on your hip. What is your pain level right now?
Right now it's at a 10 out of 10.
A 10 out of 10. Has anybody given you anything for pain?
No.
Okay. Do you have any allergies?
To morphine.
Morphine. All right. We can get you some Toradol. Okay, we'll go ahead and make a call, see if we can get your pain covered. Do you have any questions right now before surgery?
What are they going to do to fix it?
What are they going to do? The doctor's going to make a small incision in your hip. Since it's a closed fracture, he's going to be able to go in and put a surgical nail in, and then they'll use some plates and screws to put that into position. When you come out of surgery, you're going to have an abduction pillow. It's going to be really important for the first few days. You're going to be pretty much kept keeping your hips apart. We don't want you bending. We don't want you moving your hips out of position. It's important to keep that very stable. We will need you to start weight bearing as soon as possible, so don't be surprised when we come in 2 to 3 days and ask you to get out of bed. You're going to have to communicate with us about your pain level so we can keep your pain level under control. Right now, I'm going to need to go and get your consent to sign before surgery. Okay? It's me again, Mrs. Bilodeau. All right, I've got your consents. We're going to talk about this. One of the things that we need to let you know is that there are risks involved with surgery, and approximately 2% of people do have fatal complications from a hip arthroplasty. Can you think of any questions you'd like to ask me about the surgery before I go on?
How long will I be under?
You'll be under, it depends on the severity of the fracture. It looks, according to your x-ray, it looks like a pretty clean fracture. It can usually be repaired in 3 to 4 hours, sometimes less. You will be under general anesthesia, and there will be an anesthesiologist there with you to make sure that you're breathing and that your pain is under control.
Okay.
And they're also going to be tipping you onto your side during the surgery. From the time that they start to put you to sleep, and then you'll be intubated right away, you probably won't have any memories of the surgery after that.
Okay.
When you're done with your surgery, they're going to bring you back into the recovery room, and you'll see me again there.
Okay.
And we'll go ahead and check your vital signs, and we'll keep an eye on your breathing, and we'll get you stabilized before you go out to your room. And that is when your family will be able to come and see you when you're back out in the room in med surg.
Okay.
All right, so here's your consent if you'd like to read over any of that.
Bring her payment notification.
Or you don't want to sign that with pencil.
Okay.
All right. Thank you very much. Thank you.
That I'm going to tell you to avoid when you go home are things like squatting. So if you have low toilets or low chairs, you want to avoid that because that's just going to mess up the... So we want to avoid squatting. If you have small chairs or small toilets, because it's going to dislocate the hip. That's where you fracture. Okay. If you have when you like wash, if you want to put socks on or something, I want you not to bend over all the way because that can affect that too. I want you not to cross your legs. Don't cross your legs because that can also dislocate your hip. You're going to probably have an abduction pillow, which is the purpose of that is to keep you aligned. And again, that will help you avoiding crossing your legs. And when you're turning over, that's going to keep your legs straight to help avoid the dislocation of the hip. Don't sit low. Again, you also don't want to stand with your toes inward because that can affect that too. And things that you might have at home are the abduction pillow, a leg lifter, a dressing stick, and a sock aid. Okay, so again, all of this is just to help avoid dislocation of your hip. Okay?
Thank you.
what else can we do? Because if I defend the teacher, then they get off on.
Hello? Please, somebody come
If I say
immediately.
anything wrong,
Hi, my name is Nicholas Haviland. If you're one of the more than 2.2 million people that fall annually, we have the device for you. It's called the Falling Star. If you're going to fall and not be near your family or friends, nobody can hear you, press this button and it will automatically contact the emergency professionals near you. On average, of those 2.2 million people that fall every year, women will have 75% of all hip-related injuries. The majority of the injuries happen to ages 65 and up. And with that, more of them are becoming men after you hit 75. Among older adults, falls are the leading cause of death and non-fatal injuries once you hit 70 years of age. With Falling Star, we hope to bring those numbers to much less by getting people the aid they need in a timely and convenient manner. We know that you're going to fall. Don't be alone. Use Falling Star.